How does islet transplantation help type 1 diabetes? Imagine a tiny cluster of cells in your pancreas called the islets of Langerhans. These are responsible for producing insulin, the hormone that helps your body use sugar from food for energy. In type 1 diabetes, the immune system mistakenly attacks and destroys these islets, leaving the person unable to produce enough insulin naturally. This leads to high blood sugar levels and the need for insulin injections. Islet transplantation offers a way to restore this vital function. The process involves taking healthy islets from a donor pancreas and transplanting them into the recipient's body, usually into the liver. Once in the liver, these islets can start producing insulin on their own, helping to regulate blood sugar levels more naturally. This can reduce the need for frequent insulin injections and improve overall blood sugar control. One of the main benefits of this procedure is better glucose management. When blood sugar levels are kept stable, it helps prevent dangerous episodes of hypoglycemia, which is when blood sugar drops too low. It also lowers the risk of long-term complications like heart disease, kidney problems, nerve damage, and eye issues that can come with poorly controlled diabetes. For some patients, especially those who experience frequent hypoglycemia or have trouble recognizing when their blood sugar is low, this can be life-changing. In some cases, people may even become insulin independent after successful islet transplants. This means they no longer need external insulin injections, at least for a period of time. About half of the patients who receive 1 or 2 infusions may achieve this, although the effect can diminish over time as the transplanted islets may lose function. However, there are challenges. To prevent the immune system from attacking the new islets, patients need to take immunosuppressive drugs. These medications can increase the risk of infections and other health issues, including potential effects on cancer risk. Additionally, the autoimmune process that caused the destruction of the original islets can sometimes attack the transplanted ones again, leading to a decline in their function over time. Another limitation is the availability of donor pancreases. Since the supply is limited, not everyone with type 1 diabetes can access this treatment. Some patients might need multiple infusions to get enough islet cells to control their blood sugar effectively. From a broader perspective, islet transplantation is a targeted approach that focuses on restoring the endocrine function of the pancreas without needing to replace the entire organ. Compared to whole pancreas transplants, it is less invasive and carries fewer risks. Still, the need for lifelong immunosuppression and the limited donor supply mean it is usually reserved for people with severe hypoglycemia or poor blood sugar control despite other treatments. In summary, islet transplantation is a promising option for helping people with type 1 diabetes regain insulin production and better manage their blood sugar. It can reduce hypoglycemia episodes and prevent long-term complications, but it requires careful management of immune suppression and consideration of donor availability. Always consult healthcare professionals to see if this treatment is suitable for individual needs, as each person's situation is unique.